Hi, everyone. Welcome back. I'm glad to be introducing you today to a new friend, Malcolm Bohm. Malcolm is a strategic advisor and board member for multiple life sciences companies. And talking offline a few minutes ago, we just realized that I missed an opportunity I could have referred and involved him. So sorry about that, Malcolm, but there'll be next time. Malcolm, I'd love you to start off by just giving our audience a sense of your background, primarily, and then also then give us a sense of what we're going to be talking about today, and we can just dive right in.
Super. Thanks for the invitation, Stuart. So for all of you out there that don't know me, I'm a pharmaceutical physician. I've been in the life sciences industry for 30 years. Half of my career was spent in big pharma. And then the latter half of my career was actually building and exiting three companies, first in rare diseases, the second in claims data, and the third most recently was a digital marketing platform built for healthcare. So sort of half and half in the industry and half supporting the industry as a vendor.
Great, very good. So we were both attended a medical device conference a couple of weeks ago, and you spoke, and I reached out and I said, "Hey, Malcolm, among other things, I like your topic a lot. So give us a sense of what we're going to talk about today."
Yeah, influencer marketing for dummies. I mean, I don't mean that disrespectfully. I got introduced to the creator economy and influencer marketing about a year ago, and I've had some really remarkable experiences as a result of it. And so I wanted to share some of those learnings and some of those observations with you and your listeners.
Awesome. I was excited about this. I really thought it was fun, and I learned a lot. So hopefully my audience will learn as well. So let's just get off and talk about influencer marketing. And we've actually covered influencer marketing recently in a couple of different venues. This one, though, is focused really on life sciences, which on the scale of regulation is probably the most in healthcare. Certainly isn't easy ever. But you've done influencer marketing in life sciences, both for involving HCPs and DTC. So I'd love to hear some anecdotes, stories, how you would use influencer marketing for each. Just the floor is yours, my friend. Sarah.
Yeah, thank you. I spoke to a CEO a few years ago, and I was, suggesting to him that he should do social media marketing. And, he put up the cross and said, "Do not come near me again. You're the wild, wild west. I won't do it. I don't want to hear adverse events and stuff in open dialogue on the web." That since has passed, and today we're spending a lot of time and money on social media. I was that same guy about influencer marketing about 2 or 3 years ago. I just couldn't understand the concept, particularly the direct to consumer. You just have these people espousing about products, but I couldn't extend that to a regulated environment like pharmaceuticals or devices or diagnostics. But fast forward here to 2024, I actually executed an influencer program for a genetic testing company. It was the first time I'd done it. And to sort of hedge my bet, I did influencer marketing and also an omni-channel paid media strategy alongside it. We kind of tried to conjoin the two. So it's really interesting that, you do have people out there that have very large followings, and they're talking about very specific healthcare issues. Could be rare diseases or how to manage a chronic disease, how to deal with, the mental health crises that people are having. And they speak in such an authentic and credible and empathetic way that people follow them, and they'll do as they say and take their suggestions. So, the concept that we could potentially do something with a pharmaceutical or genetic test or a device kind of was a question mark I was asking myself. And what it came down to was, let's start with a disease state awareness campaign and then bridge to the brand as we start to gain traction. So let's not start by, just trying to get people to say, this brand, you must follow it, go buy it, or go ask your doctor for it. So we launched this campaign, and what was really interesting about the journey was we had to start with a very clear set of what kind of influencers do we want to find, and we needed to test the nano, the micro, the macro. macro being not quite Kim Kardashian status, but a million or two followers, and then 500,000, 100,000, and maybe 10,000. And let's just see which of these influencers, this test pilot, which of these influencers would make the difference for us. That was the first sort of challenge. How do you find them? And how do you validate that they're talking about the kinds of issues that you care about, the disease issues that you care about, and that they're doing so in a way that isn't going to scare the hell out of your brand partners. The second interesting part was that you have to, in a regulated environment like life sciences, you still got to have a protocol. You got to have the do's and don'ts. The boundaries are here, and so we had to construct a very clear set of expectations of what they could say, what they couldn't say. We had to review their content before it was published, and so on and so forth. So on the consumer side, it was a lot easier to find digital opinion leaders, as we call them, DOLs, that are basically consumers themselves. The other side of this was the HCP side of trying to find digital opinion leaders that are physicians or healthcare professionals, but not necessarily key opinion leaders. And actually, those two things are a little bit different. Key opinion leaders versus digital opinion leaders don't necessarily mean the same person. In fact, most often than not, the key opinion leaders of traditional, when we think about them, are not the same as digital opinion leaders. But we had to go through the same kind of rigor of identifying them, validating their audiences, going through the do's and don'ts of what they can and cannot say, with a little bit more liberty because they're medical professionals. So the startup of an influencer campaign was as equally deliberate and not really complicated, but you just have to be diligent about the way you do that. And that was a really important aspect of what we learned. Any questions, Stuart?
Yeah, I was just saying, okay, so let's break this down a little bit. So on the consumer side, influencers are notoriously challenging. I want to use the word difficult, but can be very difficult to deal with. And expectation setting, control, working with them, it's kind of like today's rock stars that want only green M&Ms. So, and that's a whole new, not only was that new probably to the company that you were working with, but also just different culture. So how were you able to find some influencers that might fit for this particular bill? Let's talk about that side first.
Yeah. So first off, really important, you need to find an agency that specializes in this, because you're absolutely right. The contracting process is actually the most painful of all, because each influencer has their own opinions about what the contract should look like. And if there's an agent involved, it gets, potentially more vexing. So you need to find an agency that really knows how to do this. We selected one of the stalwarts in the world of influencer marketing, which is Creators Entertainment Group. They started off as a talent management group 25 years ago, managing all of the rock stars and what have you. And they kind of birthed influencer marketing. So we felt pretty confident about their ability to do this. They use a platform, like many of these agencies do, called Creator IQ. Creator IQ. Really, really important that if you're going to consider influencer marketing, that you look at Creator IQ and they're competitive. We use that one. We didn't really have a choice. That's what Creator Entertainment we're using. But it really lets you rank in terms of the followers, and lets you look at specifically the content they're putting out. It ranks the relevancy of it, and also the amount of engagement, which is critical. You can have an influencer put out a post, and just because they have 1.5 million people, you think, oh, wonderful, 1.5 million, they're going to see it. Nuh-uh. It's actually only the engaged audience. And there are some influencers don't actually work very hard to keep their audiences engaged. So, you want to make sure that you're using an influencer with a highly engaged audience. That means that you're going to get more organic traction from it. So using tools like Creator IQ, there are others that, allow you to really rank and also detail personas, followings, content, relevancy scores. And also you can do a certain amount of matching of the brand type to the kinds of influencers that are out there.
That's great. It's funny. We are actually interviewing ahead of another agency just for that reason. And a lot of the stuff you're talking about was the same thing that she's talked about. So I'm not sure if yours will come out first or hers, but we were talking to an agency about that exact topic. On the HCP side, I'm intrigued. I've worked with thousands of HCPs personally over the year, not just marketed to them, but
Yeah,
interacted with them. And so that's a special breed. And one thing that, Malcolm, I don't know if you can relate to this, but back in the day when I was doing a whole lot more consulting at that level, doctors were just thought marketing was evil. I mean, they would pay money to come and see me speak and they'd argue with me about it, saying it's unethical. And today, younger doctors a lot of times love marketing. It's like it's part of their job and they really embrace it. When you're looking for, and I thought it was really intriguing that you mentioned that it's not really the same as a KOL necessarily. It's like, there's a different skill set, I think, to be able to really build an audience and hold an audience versus someone who's wanting to sort of speak at a scientific congress. So,
correct.
so tell us about maybe if you're looking for the HCP side, how did you guys or your agency, find likely suspects who, tends to be a better influencer as an HCP? Give us some insights over there on that side of it.
Yeah. Well, okay. This was an interesting find. So we actually worked with an agency that had all of their digital opinion leaders under contract exclusively. So these are people that have been working with them on a variety of different programs already. So they've worked with them, so that we're not breaking ice there. The company is called Medfluencers, and it's actually the birthed by a couple of physicians, an emergency physician, and I can't remember the specialty of the second one, but both of them actually were digital opinion leaders in their own right and recognized the opportunity to service life sciences. So that took a lot of sting out of it for us because we didn't want to play in the wild west. So working with that agency gave us the confidence that they had a bench. I think of about 200 digital opinion leader HCPs, not representing every specialty. So don't get too excited if you're in, endocrinology. They don't actually have a great representation in every specialty, but where we needed it, it was great. They have their own technology that they use to match up the right DOL to the kind of brand that you're working with, the disease specialty. And the critical thing with the DOLs that we found was we wanted them on TikTok, not necessarily on Meta. So this is where we diversified away from, with the DTC, it was more Instagram and the Meta environment, where with the DOLs, we were actually dealing more with TikTok. And the reasons why we went to TikTok, we wanted to diversify the channels, but we also find that TikTok has a better reach model than Meta these days, because Meta is so much pay to play, whereas TikTok still has a lot of organic reach that happens.
Yeah, it's really interesting you said that because we do a lot with our own agency, a lot of Facebook and Instagram advertising, Meta, and people don't understand that they might have 2 to 4% of followers reached with a post organically. So yeah, it's like you could spend a long time building 1,000 followers and then not reach 20 of them, or you could do tens of thousands of people pretty cheaply. So in that regard, there's a lot of advantages over there. But the influencers are a little bit different category. Tell us about, you also in your talked a little bit about, and you mentioned it before, but let's drill down a little bit on user-generated content. Any specific advice there?
Yeah, that was a really important aspect of our campaign. So, I'll get to the results in a minute in terms of the lift, but what we decided to do was use creators. Now, these are people who don't have followings, okay? These are people who are good at producing a video, basically from a script. But they do it in their kitchen, or like me sitting in here in my spare bedroom, or you with your music studio behind you. They're doing these and fairly simple production, not overproduced. In fact, it's sort of low fidelity production, which makes it feel a little bit more real, a little bit more raw, and then they overlay some graphics onto it. So the so the creators, this is a new revelation to me, by the way. I should explain. I learned that creators and influencers are very different people. Okay, the creator economy is people. I call them, let's just say moms, at-home moms that record videos in their kitchens about recipes or anything, and people love their stuff, and they get paid to produce these videos. So we went out to yet another agency and said we want to have UGC content um, by women over the age of 35 that have in some way, shape, or form been touched by ovarian cancer, breast cancer, or melanoma. It could be that they're scared for their kids. They lather them in uh, sun protection cream and all the rest of it, or they've got a family history and what have you. And so we were able to find 20 young women, about 35 to 40, that recorded these videos. They were set at 30 seconds only because we wanted to put these over paid media. So the user-generated content was produced specifically for the other side of the campaign, which was paid media. Okay. So the idea here was that we would have influencers that would be going out to their large audiences, and we'll talk about how we, structured the content and scheduled the content and put parameters around that in a second. But alongside that, we would actually drive paid media. And the paid media was really interesting because we knew exactly which audiences we were going to go for. We were going to target lookalike audiences of the engaged audience of the influencers. Let me go over that one more time. Okay, so the influencer, let's say, has 1.5 million people. And let's say 50,000 of those are engaged with that influencer on any given day. You can take that engaged audience and load it up into Meta and or Google and other platforms and develop a lookalike audience of that engaged audience for that influencer. And so what we were doing was we were putting alternative advertising in the form of user-generated content, paid, to run alongside lookalikes of the engaged audience that was going to respond to the influencer. So that was kind of the strategy that we used, and it worked very well for us.
Sorry, I got unmute there. What audience did you, or what agency did you use for you mentioned it was a third agency. I'm just curious who it was for the user generated.
Oh, a company called Expeerly, Expeerly, Expeerly. She's actually based out of Switzerland, but she has thousands and thousands of creators, actually in many, many countries, that produce this user-generated content for, and not just life sciences. They do it for all kinds of different industries.
So I love the idea of scaling with the paid and doing that based upon the lookalike audiences, but it's awesome. Have you done that? Is this all new to you? Is this all a new program, putting this all together, or how did you get that inspiration?
All new to me, and it was my inspiration. I mean, I
Sure you did.
yeah, it was just like let's do this. Everybody. Wake up, Malcolm. You gotta get up and get contemporary. So the paid media and the meta stuff was really my bread and butter in my last company, but influencers was something that I had really stiff-armed for a long time. But when I start to see just myself going on TikTok, I follow this cardiac surgeon who gives tips every day about how to do better with your heart and kind of things that you should avoid just as a regular consumer. I follow him every day. I think he's fantastic. And so I was watching myself watch these things and thought to myself, I need to get in on this action. So I actually went to a Creator Economy Live Summit in Las Vegas in January of this year. And that's kind of where the inspiration came from. I had no idea that this was such a movement. And it's powerful, Stuart. It's really powerful.
I love it. I think it's really fun. I mean, there's so much application. That's something I love. That to me, what makes this job fun is the inspiration and talking to other smart people and say, okay, how can I apply that in my life? So hopefully our audience is thinking the same way. So I want to talk about results, but you also, in your notes, we talked about a little bit about disease state awareness or unbranded versus branded and how to do both. What are some of your thoughts there on this topic?
Yeah. Um, so in this case, the genetic testing company that we were working with, they were a completely unknown brand in the United States. They had some foothold. It's an Australian company. They had good foothold in Australia, headquartered out of Melbourne. Really interesting working with them. But absolutely, really no brand recognition whatsoever, both at the HCP level or the DTC level. Um, and their tests are a little bit different. They measure the risk of potentially getting a disease based on your genetics and also some relevant parts of your medical history. So if you take breast cancer, which was what we were piloting in this campaign, if you have dense breast history of breast cancer in your family, etc., then there's a higher likelihood of breast cancer. But moreover, they test a lot of different genes that people are not aware of that cause sporadic breast cancer. So we all know the Angelina Jolie story, which is the BRCA1 and BRCA2 genes, but those only account for about 8 to 10% of breast cancer incidence. So 90% of breast cancer is captured in sporadic disease. And these tests actually will give you your risk for contracting that kind of cancer, and they have a whole range of these disease risk tests. So it's a new category of a risk test, not a detection, not a diagnostic, right, and a completely unknown brand. So, we decided, look, if we try and hammer the brand kind of out of left field to people with this new category, it's not gonna go well. We need to actually talk about defining what risk is and how changes to lifestyle and activities that you can take to reduce risk of certain diseases. So we did a disease state awareness campaign, typically unbranded is the way we refer to it as. And then the branded came after we'd established some credibility and some following with these audiences. I should also say that we did build their social presence using the disease state awareness unbranded approach. When they arrived on our shores, so to speak, they had about 2,000 people on a Facebook page, and we got that up to 20,000 people in 6 weeks, and took the engagement level from 0 to 17%, which is pretty darn good. And we had a lot of women talking about their risk and what they had been through, and that was really the virality that we were trying to generate. And then once you've established that beachhead of sort of thinking about, gosh, could I be at risk for breast cancer amongst these female audiences? You can then introduce the brand, and that was another layer of paid media where the branded advertising was going to come around in a 360 surround sound around the rest of the campaign.
Standing. So let's talk a little bit about the results. I mean, how did this all go? And any other insights you'd love to share?
Yeah. Well, this is why I'm on this podcast talking about it, because it was really astounding. We increased sales by 500% in 1 week.
Wow. That's awesome.
It was insanity. It was one of those ones where you wish you had a little bell for every time the checkout rang, because it was just going to go ding, 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 ding. And it really did. It was amazing. As soon as the influencers turned on their content, I'll come back to the scheduling of that in a minute, the bell started to ring. I mean, it was almost immediate. And I was floored, because this is the first time I'd really seen, wow, these audiences that are faithful and follow these influencers really do act. I'd heard about it, sort of, fabled stories of massive lifts in sales, but I never believed it. And this was, life sciences brand, but it worked. It worked really, really well. And people were moved to purchase these tests that give them their risk over 5-10 years and lifetime risk. So it was interesting. And the other thing I should mention about these tests is that there's an HCP involvement via telehealth to adjudicate whether or not the test is approved, is prescribed. So you can't just buy it. You have to buy it and then actually be approved to have the test. Uh, so it is not quite straightforward to just buy it off the shelf, which also added sort of delight to us because it was an extra step that was involved. You come in, you start, you check out, you then have to be adjudicated, prescribe the test, and then you could actually pay the money and go through the process. So the increase in sales was immediate. It was fantastic. What we learned though with the influencers was when they stopped talking about it, the sales stopped very quickly. Because they're off to the next thing. I mean, these influencers are pretty, they're pretty busy. So one of the things that we learned was, look, you have to set constraints around the content, and we had to sort of step in and change the rules for the influencers, because if we didn't say, hey, no other story for 12 hours after you've done ours, then more fool us, because they would immediately, go to the latest diaper and talk about the latest diaper immediately after our life sciences genetic risk test story, and it didn't jive. So we learned a few things along the way that you have to make sure that you give your content some real window, and also you have to give it a timeline. So your story is here, but then there's posts that follow, and then there's a permanent link that needs to be put up on that profiles. All of these things we were learning sort of on the fly to get it to work better for us. And then last thing to say about the UGC, which was going over paid media while this was happening, those videos generated 150,000 link clicks for us in a month. So we generated a lot of activity at the website. And what we found was when that UGC video paid media was in sync directly with the influencers and what they were doing, sales shut up. When the influencers came down and their stuff started to wane, the paid media, it also plateaued a little bit, but it then became more sustained. So you could see how the influencers were really impactful to almost like jumpstart the whole campaign.
Yeah, it's really interesting because the user-generated content and paid media is scalable, and that
Yes,
you can control that. You've got lightning in the bottle with an influencer, but like you said, when it's over, they're on to the next thing. So
yes.
it's like you used it more as a catalyst, like starting the campaign off already. Are you still using some of that user-generated content for this client? Are they still, because that's an asset you guys build. I'm assuming you got the rights for that, so you can continue to use
Correct. That's right. That's right. So when you sponsor that user generated content, that's another part of the pie that you're going to be really careful about, that you do get the rights to be able to use it. In this case, we get the rights to use it for at least 12 months. And if we want it for longer, then there's a longer license and you can negotiate. And that's exactly the same with the digital opinion leader HCPs. Same thing. You have to be really clear how long you want that license for. And that HCP digital opinion leader content is a lot more expensive. Audience, it's a lot more expensive.
Yeah.
These are doctors under exclusive relationships with large audiences, and they expect to be paid well for their time and their opinions and all the rest of it. But very, very important to have them alongside, because just having influencer X for consumers is not nearly the same gravitas as Dr. So-and-so from John Hopkins. Doesn't necessarily mean the consumers will know that individual very well, but it has a very, very important halo effect.
So when you're using the HCPs, were you using the HCPs for credibility towards consumers, or were you trying to influence other HCPs? What was the strategy?
It was actually both, and that's where the both came into my notes. Without the digital opinion leaders actually also going over consumer audiences, I think we would have lost traction. It wouldn't have been quite as successful, but we were purposefully putting out the HCP content over the consumer audiences at the same time. So we would have a user-generated content by a young lady, let's say 40 years old, who was talking about her experience. and then we would also be peppering those same audiences with individual HCP vignettes as well. So those are really important to mix together. And then on the other side, of course, polygenic risks testing has not gained a lot of traction in medicine yet. It's very important, I think, but it hasn't gained a lot of traction yet. And so showing PCPs in particular that this is actually something that you can use without needing to be a specialist to determine whether or not your patients should in fact be referred to specialists or should in fact be looking at lifestyle modifications. Really, really important that polygenic risk testing was given some credibility from opinion leaders.
So I'm going to come back to the future in a moment. But you did mention when we talked about this, and you've already talked about some of your specific agencies and some of the tools. Are there any additional tools you think people should be aware of? Or because we talked about the agency side, I think, but I'm just curious because that was
so Creator IQ was an important one, but the other one, which is a tremendously powerful platform, is called Stat Social. And I'm a big fan of Stat Social. Let me explain very briefly what it does. So in the old days, in the very old days of Facebook, you could target on certain medical conditions. If I wanted to go after, let's say, arthritis, you could target arthritis and as an interest group, and it would be delivered to people who talked about arthritis, have liked arthritis, et cetera, et cetera. Since then, Facebook and Meta have redacted our ability to do that. Stat Social brings it back for you, because what they're doing is they're identifying everywhere where people are following influencers and creators that are talking about whatever topic they want. And those can be on TikTok or Facebook or Meta or Google, Reddit, Quora. It doesn't really matter. The core thing that they're able to do is get the emails of those people that are engaged around those influencers and creators. And the email then is loaded up as a custom audience, and lookalikes are built off of that. And that's what the output of Stat Social is. It allows you to go and say, I want people who are talking about diastolic blah, 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 or pulmonary arterial hypertension, or whatever disease it may be, or symptoms thereof. You can build an audience and then build lookalikes on top of that. And that was a really, really powerful extension. I had not seen something that gives me that fidelity in targeting in a long, long time. And I was very excited about it because, my last company grew up on the ability that we could target across the medical dictionaries. And when that was redacted, we had to do major pivots at our company.
Yeah, I've heard Stat Social a lot in recent conversations, so it's really intriguing to get that point of view. Couple last questions. One, any special topics, given that this is a little bit different kind of a company, but on the regulatory side, were there any challenges that you saw that you guys had to overcome, or anything that, or just in general with this topic, people should be aware of and start getting into life sciences, that anything at all, like myths, tips, whatever?
Yeah. So, as you might expect with life sciences, the run-in period was longer and more painful than the actual campaign itself. So working with medical, legal, regulatory, we had to align those forces with us. And, in some cases, it was totally new territory for the legal people. And so, we had to beg them to tell us, don't tell us how we can't, tell us how we can. So that was interesting. Just a heads up, it's a longer run-in period. So when you're planning for a campaign, plan at least 3 to 5 months of putting this whole thing together, because once it goes live, the cat's out of the bag, and everybody's going to be really, really confident that everything's okay. So that was an important lesson. And I can tell you there was quite a lot of late nights and sleepless nights as to whether or not we were going to pull this off, but we managed to do that. But yeah, it's like social media. Like I said at the beginning, 10, 12 years ago, no way, we're not going there. And that's kind of the ground we're breaking with influencer marketing in pharma.
All right, that's excellent. So one more question about the specific client. So they put a lot of money and time into this. Like, this certainly couldn't have been inexpensive. Are they using the platform? Are they going to, is this just the first phase of, I mean, that's something that's confidential, but like, it feels like to me, you've created all these assets. This is the foundation of sort of whole broad new horizons. Is that fair to say?
100%. 100%. So when we did this with them, we told them, look, you know what, we're going to have to make an investment here, and the investment is going to create assets that will have a life beyond the pilot. If the pilot doesn't work, then at least we can say we tried everything, and this brand is not meant for consumers or or physicians. It's just not going to get the uptake that you hope. And they had tried a lot of things before it hadn't lifted off. Part of that was because polygenic risk is still young in its acceptance. So yeah, there was a significant budget, but it is continuing today, and successfully so.
Right. I think it's one to sort of comment. I think the test that you chose was a good one. That's something that it's emotional. It's a high risk in the population. It's not some really non-emotional rare thing. Women are concerned about breast cancer just like men are in prostate cancer. So for that being starting there was probably a really good idea, because it's the kind of thing that would relate to broad audiences. I guess, any final comments, anything we missed, or especially advice to people that are considering this within any category of life sciences or anywhere, any other final thoughts?
Well, I just go back to what I said previously. You have to use professional agencies. It could be your agency steward, but you need to go. Don't think for a second that you and your brand team can pull this off. You're going to be stuck in contract land for a long time, dealing with minutiae that you're not trained to do. This is where specialist support is needed, and I just threw my ego out the window with this one, and just belt and braces. Did the RFPs and made the selections. You do need specialist support. You need specialist tools. You can't just rely on. Gosh, I saw somebody on TikTok yesterday, and they had a viral video about heart disease. That's not good enough.
It's that's so funny, and I think of going into this campaign, and one of our things when we talk to prospective clients about healthcare marketing is a world of specialists, and so we have a lot of people internally. If we were going to do this with influencers, we work with a partner, and we have partners for that because it is specialized. And the other thing is, you made me giggle there a second ago, because some people say, okay, we'll do this, but what if we're not getting the phone ring by the first week, then what? And it's like, should we cancel? You really shouldn't even participate. If you're looking at the exit before you even start, this is not a place for you. There's a lot to this. This is just the legal fees alone are probably substantial, and then the different agencies and your time, and then the influences themselves, and the media costs. Like, there's a lot there. So I think it's a more of an enterprise enterprise play. But I got to get credit to your client to having the sort of commitment to doing this the right way. You're getting in it. A lot of times people are afraid of being the pioneer because they're afraid of getting the arrows as opposed to the rewards. But good job. I remember now why I liked your talk so much, Malcolm. This is great. So thank you for letting me on us, and hope to have you back someday, and hope to work with you on a mutual opportunity here in the future. That's good.
Thanks so much, Joe. Good to see you. Cheers.